Okay. All right, Joe. So we can officially open this meeting at 18:04. Do we have our secretary hooked up to
Yes.
take minutes? She's all set?
Yes.
Okay. So call this meeting to order at 18:04. First item is to approve the minutes from the January 12th meeting. I assume Margaret and Stan, you've had a chance to look at those. Somebody want to make a motion to approve them?
I'll make a motion to accept the minutes of January 12th.
Second.
So roll call vote, all in favor. Juanita Carnes, yes.
Margaret Duty, yes.
Stan Stremko, yes.
Okay. Next item is public participation. And I know there's many people that want to speak, but as per the open meeting law, we will continue with the 15 minutes of public participation. We have a lot to cover tonight. So I see a hand up on Jean Paya Wilson.
Yes, thank you.
Hold on one second. Joe, are you timing?
I will, yes.
Thank you.
3 minutes.
Okay. Hi, my name is Dr. Jean Powell Wilson, and I'm a clinical psychologist. I wanted to just talk to you about 2 points. I was looking at the data on the COVID dashboard for Westfield, and what I noticed was that there was a discrepancy. It is reported that the number of new cases from January 13th to the 19th, it's stated as 700 new cases to be confirmed. But when I checked it with the mass.gov Department of Public Health, Westfield, for the city of Westfield, the new confirmed cases, it's 257. And again, when I look at the period for January 20th to January 26th on your dashboard, it's reported as 500, the new confirmed cases. But then when I look at the corresponding period, within that time frame from January 16th to January 29th, it's actually not 500, it's 122.1. So how can 500 cases be within 122.1? I just would like to point that out because that seems like that this is not the right numbers. And I know that the right numbers are needed to address what we're trying to address and to see if there really is a pandemic. If you're falsifying the data, which has been noted to be an issue with this Board of Health, please feel free to double check, inform me, let me know if I'm wrong. I would be happy to be wrong, but if you could double check that, that would be very important, because what this brings me up to is the point that, are you fitting the numbers to fit the data? Are you fudging the numbers to fit the narrative? Or are you really looking at what is the truth? Because this is a pandemic of the vaxxed. I know that we've been talking about it as if it were the unvaxxed. We often look at the cases and we say that because the cases are increasing, oh no, we need to increase the vaccination rates. But according to an article dated January 21st of 2022 in Mass Live, breakthrough COVID cases in Massachusetts now equal more than half of the total number of new cases. So what does that mean? It means that in the weekly report through 115, there were a total of 132,000 new cases or so. By itself, that sounds very scary. And one can think you need to get vaccinated, but let's get a little more curious about this data. How much of these new cases are coming from the vaxxed? How much are coming from the unvaxxed? Of these cases, 65% represent breakthrough cases, which means that cases came through in individuals that experienced vaccine failure. In other words, out of the 132,000 or so cases, over half, 65%, happened in people who already had the vaccine. Yes, the vaccine that was touted to prevent the transmission of COVID has failed. And now the people who got vaccinated, are still getting COVID. If more than half of the new cases are from the people who got vaccinated.
Thank you very much. Can we move on to Adam?
Hi, my name is Adam Ripka. The health department has indicated on the city's website that it will no longer be reporting COVID-19 case numbers and other data, citing the fact that the numbers will no longer be accurate due to the availability of home tests, which are not reported to the city. The Board of Health's justification for the indoor mask mandate has always been based on the number of cases, or more accurately, positive test results, many of which come from people who are asymptomatic, which to my knowledge has never been the criteria for a case of a disease. If we tested as aggressively for other viruses, we'd likely be in a perpetual pandemic, but that's beside the point. Given that the positive test metric is no longer valid, I'm wondering how the Board of Health will justify the mask mandate going forward, and more importantly, what metrics will be used to decide when to end the mandate. Given that the number of cases increased significantly after the mandate, or maybe not, according to what Jean just said, took effect, it's clear that the mandate does not have the ability to stop the spread of COVID-19. We've all heard the phrase, the best defense is a good offense. Instead of clinging to failed protocols and unconstitutional mandates, the Board of Health should be going on offense to promote health in the city, instead of just playing defense and attempting to prevent disease. After all, it's called healthcare, not sick care. Why are we not encouraging hospitals, doctors, other medical professionals, and even the citizens themselves to make better health choices to boost their immune systems? Our government is spending trillions of dollars on COVID shots, tests, and other measures that have failed us. We could be spending a fraction of this amount by providing vitamins, minerals, and early treatment options to keep people out of the hospitals and save countless lives. I realize our Board of Health has not been directly involved in most of what the state and federal government has done, but they have towed the line with the CDC and other agencies. We can't change what has already occurred, but we can change course. The status quo is unacceptable. End this mandate and start promoting health instead of fear. I'm sure you're all aware that Governor Baker announced today that the school mandates will end on February 28th. If these mandates are based on science, I'm wondering how his administration was able to look 19 days into the future to determine that this would be scientifically feasible. Lastly, I just wanted to remind everyone of the December 8th Board of Health meeting. This is the meeting where the board discussed putting the mandate in place. Dr. Stremko said, quote, most of our neighbors have mask mandates in place, end quote. At that time, East Hampton was the only city nearby that had an indoor mask mandate, and they don't even directly border Westfield. To my knowledge, Agawam, Chicopee, Granville, Russell, Southwick, and West Springfield still today do not have indoor mask mandates. So that statement was false on December 8th, and it's still false today. One last thing, if I have time, there's nothing in the open meeting law that says there can only be 15 minutes of public participation. Thank you.
All right.
Sandra?
Thank you. And I want to thank the Board of Health for your efforts to try to keep us all safe. I've lost 3 friends to COVID in the last 30 days. One lived in this area and the other 2 lived in other parts of the country. One was 55, one was 60, and one was 69. 2 of them were RNs and the other one was in IT. One of the nurses went to law school several years ago, and so she became an attorney and an RN. The RNs had not worked in patient care for many, many years. They'd all worked hard and had reached the peak of their careers. They were very smart, very accomplished people. More importantly, they were good people, and they had a lot in common. All 3 worked primarily from home. They had comfortable homes and loving families. They had children and grandchildren. They had plans for their retirement. They had the best health insurance money could buy, and they all lived near major medical centers. They didn't go to concerts, sporting events, or crowded bars. They didn't smoke, they exercised, they were not obese, they did not drink alcohol to excess, and they took care of themselves. So here's what else they had in common. They were unvaccinated. They believed in natural immunity, and they took supplements to build their immune systems. They've left behind heartbroken spouses, children, grandchildren, colleagues, and friends whose lives will never be the same. We've all been so busy going back and forth about masks, our vaccination problem hasn't gotten a lot of attention. Hampden County has the lowest vax rate in the state, the highest death rate. This is not a coincidence. I know many people who've died of COVID, all around, most of them around here. I've lost track of how many. Some died from COVID before we had the vaccine, but everybody else, all of whom were fully vaccinated, were sick for a week or so, and then they recovered. These 3 people are the only ones I know who died since we've had the vaccine available. And that's because, sadly, they were unvaccinated and they were sure that they'd be fine. I know that not every unvaccinated person dies when they catch the virus, but some of them do. And people never think it will happen to them. So please, everybody, think about the people in your life, the people who love you and will miss you forever. They're the ones who will have to plan your funeral. Think about your children and your grandchildren you want to see grow up. This is a tragedy that didn't need to happen. Please get vaccinated. Do it for the people who love you. Thank you.
Thank you. Gabriella?
Thank you for the opportunity to speak to you today. We are all ready for this to be over. We also are thankful that this newer variant going around seems to be much less damaging than the Delta virus variant. But we are still concerned about the number of sick people. There have been a lot of studies that show vitamin D, low vitamin D has significant risk if you get sick. And I really don't understand why that is not people aren't being reminded of that, to get their vitamin D levels checked. The mask mandate, it is time to remove it. The state has decided that the schools are safe enough to remove the mask mandate. The cities, we still have the decision that we can make for ourselves. And I believe that individuals know enough by now to make that decision for themselves. I ask you to stop putting pressure on the businesses to enforce something that you don't have any enforcement ability to do. You're passing that responsibility to business owners, and the business owners are already struggling because of the pandemic and the shutdown and all the other things that they have had to go through. So for the sake of freedom and the sake of our businesses, I would ask you to trust the adults in this city to make decisions for themselves and their children. I would greatly appreciate you considering doing that very soon. Thank you.
Thank you. And lastly, Katrina?
Can you hear me?
Yes.
Thank you. Can you mute me? My apologies to Sandra, who lost some people from COVID. I do want to just say, though, that I do know people who were vaccinated who died of COVID also. So on April 18th, 2020, the US FDA issued an emergency use authorization, or EUA, of face masks for use by the general public. An EUA permits the use of unapproved medical products and devices. The FDA considers a product a medical device if it meets the definition per Section 201H of the Food, Drug, and Cosmetic Act. That states that a medical device is an apparatus intended for use in the diagnosis, cure, mitigation, treatment, or prevention of disease. So a face mask is indeed a medical device, and being used under emergency use authorization, it is by definition experimental. In the federal regulation regarding the protection of human subjects, Section 50.20 states that no investigator may involve a human being as a subject in research covered by these regulations unless the investigator has obtained the legally effective informed consent of the subject or the subject's legally authorized representative. The people of Westfield have not provided their informed consent. Therefore, this mask mandate is in violation of U.S. federal code. Furthermore, the mandate has proved itself ineffective. In the 3 weeks after it was put into effect, cases increased significantly by 39, 222, and 315, respectively. It has placed an undue burden on our small businesses, in which business owners have been coerced by the threat of a $1,000 a day fine into feeling like they have to be enforcers on their customers. It has harmed our community by resulting in outward hate, division, and hostility, in which citizens have been policing and yelling at other citizens and discriminated against. Due to it being a violation of federal code, and for all the further reasons I just stated, the mandate is deemed unreasonable and therefore is unlawful per Mass General Law, Part 1, Title 16, Chapter 111, Section 31. Thank you.
Thank you. So that will end our public participation. Joe, do you want to go next with the? Okay, we can do, Jessica, I think, is the only other hand up, but I think to extend public participation, we need to have a vote in order to do that.
With a definitive amount of time.
With 3 minutes. 3 minutes.
I
for the
make a
last
motion to allow one more speaker for 3 minutes.
Second,
And roll call vote in favor, Juanita Carnes.
Margaret Duty, yes.
Stan Stremko, yes.
Okay. Go ahead, Jessica.
Okay, thank you. So I'd like to start this. How can we keep pushing these mask mandates and vaccines for the last year, year and a half, when clearly we see, one, that they don't work, and two, that they aren't safe? Is this really about our healthcare, or are there other motives in play? I'd like to quote a speech real quick from Dr. Robert Malone, the inventor of mRNA, when he spoke at the DC rally 2 weeks ago. We should not have politicized the public health response to SARS-CoV-2 and COVID-19. Regarding the genetic COVID vaccine, the science is settled. They are not working. They are not completely safe. Now we have Omicron. These vaccines were designed for the original Wuhan strain, a different virus. Whether they make sense for protecting our frail and elderly, the original virus is irrelevant. We must look forward. The vaccines do not prevent Omicron infection, viral replication, or spreading to others. We see this in our daily lives with our family, friends, to hold true. These genetic vaccines are leaky, poor durability, and even if every man, woman, and child in the United States were vaccinated, these products could not achieve herd immunity and stop COVID. They are not completely safe, and the full nature of the risks remain unknown. In contrast, the natural immunity which healthy immune systems develop after infection and recovery from COVID is long lasting, like T memory, B memory cells, broad and highly protective from the disease and death caused by the virus. If there is risk, there must be a choice. Thank you.
Thank you.
Good.
All right, so next, Joe, do you want to give a update?
I will, yes, I do want to. I do desperately want to give an update. And thank you for everybody that spoke tonight, and your words are heard. So I can assure you of that. So basically where we're at from where I sit as far as the COVID situation, and I know it was mentioned about the not reporting out of the new confirmed cases and all of the other metrics that we've done for the last 2 years. Times are changing. We need to pivot. Inaccurate data is misleading. It's dangerous. And we can't wrap our heads around with the new available home testing what the metric actually is. So there is no hidden agenda involved with not reporting out these cases anymore. It just is the fact that if we can't give correct information, then it's not useful to people to base their decisions on, including the board. So one of the things that was mentioned, and I don't want to speak to this directly, but what I'll say is a statement of fact that when we reported out for the last 2 years our new confirmed cases, it was done through a surveillance software, communicable disease surveillance software from the state called Maven. You can look into it. All of our numbers that we got from them were exactly what we reported out. We kept track of it on a daily basis. If there's a discrepancy between the state data and the city data, it's not an intentional thing. It may be a flaw in the system. But when we get reported cases, we report those out accurately based on the information that we get on a daily basis, again, through the surveillance software. So I know the state is a lot of times delayed in their reporting of information. We're more real time. So that's the issue with that. The other thing is, as far as not only being able to not report out accurate information for new confirmed cases and school-age children, because they have now their system in and of themselves. The only thing we can really rely on as a metric is deaths and hospitalizations. And hospitalizations are very difficult to obtain with any sort of accuracy. I like to think that we can defer to the professionals that we have on the board that work in those facilities to tell us whether or not hospitalizations have increased, decreased, or remained the same. And I think that needs to be a trusted source of information. So with all of that, it's just gotten to a point where I keep saying, COVID right now is not the same as COVID was a year ago. And we need to adapt to that. And, we can't do contact tracing anymore. The state abandoned their contact tracing collaborative, as I've said before. That is not something that we can allocate our resources to anymore. It takes, if people don't know, an inordinate amount of time to do contact tracing, and not only to do contact tracing, but to populate a list of new confirmed cases when our numbers are in the hundreds. That is at this point, a not useful resource of the taxpayers' dollars, our nurses' time when they can be doing other services for the community. So we've just gotten to this point where we need to really transition into different control measures. Vaccination is I think the key effort that we're getting from our mother agencies, and that is the CDC and the Department of Public Health of Massachusetts. So that's what we're looking at. Those are the metrics that we're trying to base decisions on. And what I would like to do right now is really for the board members, hearken back to old school discussion of the matter at hand within ourselves, not necessarily statements, not necessarily any answers to concerns, but let's talk about what we're going to do. Where are we now? And I would just like to open a discussion with the board members.
All right, so like you said, we're in the real world of taking care of patients, and I have definitely seen a decrease, and thankfully, in COVID in my work. I think there is something much bigger than this meeting, this board, this department, or a mask mandate in this city. Even though locally we're looking better, our nation has lost 100,000 lives due to COVID since Christmas. The country's total loss is nearing 1 million. My neighbor, just as Sandra was saying, my neighbor has had 3 of his close friends die within 2 weeks, and he's been in the hospital 2 weeks, texted me today. He took his first step and cried because this is a normally very active guy who was able to take a few steps for the first time in 2 weeks. So I think we need to definitely continue to look at the big picture. There's a few items that I need to clarify. And we've received some feedback on complaints that when we had a meeting for the mandate vote, that we did not do public participation. I want to clarify that a public participation is not required. It was strictly a meeting to vote on an action item. And public participation was held at our regularly scheduled meeting the week before. And per the law department, it was not required. It was not a purposeful or calculated omission. There's also been some very ugly accusations thrown at this board, as well as other legitimate organizations that support the science and research that guides us through this pandemic. I stated before, and I still assert, that everyone has a right to their opinion, but that also involves being civil. This board has and will remain civil and respectful no matter who throws unfair character judgments and more at us. Our path is guided by up-to-date research and guidance from the experts, real-time experience in healthcare facilities and the public health arena. I don't believe it's productive for any board of any kind to engage in continued debate with those firing insults at them. Our role is to listen, filter out misinformation, and do what's best for the public health of this community. And that's what we've all been doing with no hidden agenda. And having said that, I've been asked to clarify my reference to the feedback received regarding the mask mandate prior to the vote. Somehow this led to a search of city emails. My reference was a broad reference to all communication received in any format to any of us. It was not a specific reference to city emails being 50-50. And furthermore, it's irrelevant because my vote is not influenced by public opinion, but by science, case numbers, and facts. It's only fair to also mention those that have supported us via means of communication, many means of communication, and there has been a lot. And I thank all of you and I appreciate it. I especially want to thank Mike Camerata for his clear perspective in his letter to the editor. Our decision-making regarding the mask mandate has not, nor will ever be taken lightly. It is not and never will be a political decision. The World Health Organization recommends caution in lifting any mandate. The current epidemiology, at-risk populations, immunity, access to healthcare, all need to be taken into account into each local area when they decide on their restrictions or lifting those restrictions. You can't blindly follow other cities, states, or countries, or simply respond to public fatigue. We're all tired of the pandemic. The CDC continues to recommend masks as an effective way to reduce the spread, especially indoors. Mask wearing is more important for anyone with a weakened immune system, elderly, or unvaccinated. Mass DPH recommends wearing a mask or face covering when indoors, regardless of vaccination status. As a city board of health, our main focus is here in Westfield, although it is foolish not to take into the big picture and history. But locally, we're definitely seeing a steady reduction in cases. And again, our numbers no longer clearly reflect what's actually happening because of home testing, people who aren't getting tested. If we were still in the midst of the surge we were in several weeks ago, I would certainly vote no for no change in the mask mandate. Locally, the situation is improving. And again, we have no specific metric to prove that. But again, based on the epidemiology in the area, my suggestion is to downgrade the mandate to a strict advisory effective immediately to be reevaluated in 1 month. Please remember, if this does pass, that each and every business has a right to continue a mask mandate, and that needs to be respected by our community. The state also has mandates on public transportation and healthcare facilities. And hopefully I won't be regretting this, as this virus has repeatedly proved to us that it is very unpredictable and deadly.
Thank you, Juanita.
All right. Thank you, Juanita. Thank you, Joe. So I'm I'm cautiously very optimistic, honestly. There's been a rapid downward trend in essentially all the metrics that I'm looking at starting 10 days to 2 weeks ago. And that trend's been accelerating. If you look statewide, the 7-day average of new cases is way, way, way down. Hospitalizations and deaths are lagging indicators, but hospitalizations and deaths are significantly down. A really important leading indicator are the wastewater numbers, and they've experienced a rapid downward trend. More importantly, to us here on the board, locally, the situation on the ground has just improved dramatically over the last 10 days to 2 weeks, especially the last week. I can tell you from my view, boots on the ground, local healthcare is no longer under the extreme stress that it was a month ago, which was unlike anything I've seen in 36 years of doing this. Including 3 years on a tropical island in the middle of nowhere. So I would agree with Juanita. I'm happy. I'm like ecstatic that that I think we're in a position where we can recommend rescinding the mask directive and moving to an advisory.
And
Stan?
I also agree with Stan and Juanita. And I would like to thank the residents of Westfield for those that put up with wearing a mask without complaint, wrote letters of support to the board. And they not only protected themselves, but they also protected the unvaccinated and the people that didn't wear masks by doing their part to alleviate the spread. And we can't say with any certainty that masks were the cure-all, but it certainly helped in Westfield to decrease the amount of cases we had. And I also would agree to lift the mandate at this time. However, I would ask residents to strongly abide by the mask advisory to wear the mask.
Okay. Juanita, if I may.
Go ahead.
All right. I don't have a statement to make, but I just want to thank the board for their support. And I want people to understand that what was just discussed was obviously and clearly based on the metrics and the science. And the motion that may be made to rescind the mandate, I hope everybody knows who is out there that this is not, there's no conspiracy involved with this. These people, these 3 members of the board, have gone above and beyond to listen to the mother agencies, look at the data that's out there, make an informed decision about what's best for the public health. And you have to understand, the public health is not the 16 people or whatever that are on this call, it's the public. And I can go into that in great detail. So one thing I have to say also is about the communication involved with throughout all of the adversarial mask mandate. There's only been one person on this whole call that has ever actually called me and engaged me in a conversation, and you know who you are. And I appreciate that. This one-sided email contribution is not, we can't communicate that way. We're people. You want to be a keyboard warrior and you want to send out emails to express your opposition, you have the right to do that. But I can guarantee you're going to get more information and better results when you actually engage with the people that are making the decisions, because you want to be heard, but so do we. And so kudos to that one person out of all of you who actually connected with me, and we had over an hour conversation, and I appreciated it. And moving forward, just let that be said. Next time, call me, please. That's what I'm here for, and I can explain. So, Juanita, where do you want to go from here?
I think before we vote on the lifting the city mandate, in reference to Governor Baker's and the Department of Education lifting the school. Our city presently, along with that, has a mask advisory in place for all Westfield public schools. And I believe we should vote to continue that. And that's separate from the other vote.
So just so I'm clear, so prior to the citywide indoor, public indoor place mandate, the board had passed a mandate to require masks in all public schools?
An advisory. Didn't we have we had an advisory in place?
I think it actually mandated it in the all public, parochial, and private schools.
Okay. So we're gonna,
So that's on the books right now. So if the board wants, just to be consistent with the governor and DESI, if the board wants to entertain a motion to rescind that mandate and turn it into an advisory,
okay.
consistent with the governor, then I think that would be appropriate if anybody wants to make that motion.
Okay, I would make a motion to rescind the original mask mandate in public and private schools
In Westfield.
in Westfield.
Second. And a vote by roll call. Yes, Juanita Carnes.
Margaret Duty, yes.
Dan Stremko, yes.
All in favor? Aye.
All right,
All
so
right.
just for the record and for the minutes, that means that I don't know what the date of that original vote was, but it was before the citywide indoor public place mandate that required masks in all public, parochial, and private schools, has now had a motion to be the mandate rescinded and turned into an advisory, right? So we
Right.
can have that clear. Okay, good. And that's, and that is, it would be effective as of February 28th, as the governor and
Yes.
DESI also, okay, consistent with that.
Why don't we, I mean, again, here, the board, I think, is appropriately taking a subservient posture to DESI. Why don't we just remove the mask mandate for schools now? And simply defer to DESI and their timeline.
That's a good point, Stan. I was just trying to have it be a little, my recommendation was to just have it be a little bit more consistent, but you're right.
I think it's just cleaner that way. The schools don't have to worry about us. They deal with DESI. I'm okay with the privates doing what the privates want to do at this stage of the game. Personally, I don't know how Juanita and Margaret feel, but personally, I think that would be appropriate.
So if anybody wants to make a modification of the motion to say that the rescindment of the mandate for all Westfield schools not go into effect on February 28th, but effective immediately.
I would go in the timeline with the state. I would prefer to go on the timeline with the state, February 28th.
I think I would agree with that also, just because families have kids going to public school, some to private, and I think it would be cleaner if everybody, when it was on the same page, both systems.
I'll certainly defer to Margaret and Juanita.
Well, so then I believe the vote was already taken with the time frame of converting the mandate to an advisory as of February 28th.
Correct.
So then there is no motion to modify that, and we can just stay with it, okay?
Correct.
Good.
All right, so the
Juanita?
next vote will be to lift our mask mandate for the city and downgrade it to an advisory. And we have the decision of making that effective immediately or at the end of the month, or Stan, Margaret, do you have feelings about that?
Yeah, I do. I mean, again, based on the numbers that I just ticked over kind of in general form, I don't see why we can't make it immediately.
Immediately? Okay, I'm good with
I would
that.
agree with Stan on that also, effective
Okay.
immediately.
Can one of you make a motion?
I move that the board vote to rescind the mass directive effective immediately.
And continue an advisory.
Correct.
All right,
I would agree.
Can someone second that?
I second that.
and roll call vote. Yes, Juanita Carnes.
Yes, Margaret Judy.
Yes, Stan Strumko.
All right, all in favor, motion approved.
Thank you. So, and just one other comment to hopefully, I hope the board gets the accolades that they deserve in line with the criticism that they also got. So we clearly see that this is a transparent process, and I just want to let everybody know that, you know, this was all well-intentioned, and I know the board would concur with that. So if you have any questions or comments, please feel free to reach out to me. I prefer that, and I would love the feedback, especially if it's positive at this point, because this has been as you can all imagine, a horrible experience. And even though that's our job, that's what we do. So thank you all for your words. Thank you all for your concern and your consideration. And thank the board for being very professional, and we're really, really lucky to have these people here. So that's my perspective. Would we like, go ahead, Juanita. Sorry.
Can I just add to ask everybody to drive by the green on Valentine's Day, February 14th. There will be a candle for every Westfield citizen we have lost to COVID.
All right.
From 5 to 8.
Thank you.
Thanks, Juanita.
Shall we move on?
Okay.
And I don't mean literally, I mean figuratively. Please, can we start doing restaurant inspections again? I think we need that.
Yes.
Yeah, a lot of services have been jeopardized by COVID, so we're hopefully being able to get back to not the status quo, but at least, you know, some semblance of order. The next item on the agenda is a nursing division update. Am I correct? I don't have an agenda in front of me. Okay.
Yep. Next
So I
in
just want to let you all know that officially we have taken a health department nurse, staff nurse, and we have relocated her to the senior center. Much needed service. This has now officially happened. I know I talked about it as a possibility, but she is there. Evelyn Bristol is now the health department staff nurse at the senior center with her own office that will tend to the needs of those people, of that population, who have desperately needed that for a long, long time. And she's there full time. So, and she loves it. They love her. This is a wonderful, wonderful thing. I don't have any idea how we actually made that happen in the midst of everything else that was going on. But as you can see, there's progress to be made. And that is a huge step. So serving that population with that public health nurse over there it has proven already in just the last couple of weeks to be invaluable. So that's an update on that side. The other part of it is in the nursing division, and this is where we're moving into the promotional part of public health, is that I'm asking the mayor for some funding to get a third nurse position, which we have a person here right now who's actually doing a kind of internship and part-time nursing services. we need that third nurse position now that the second one is over at the senior center, so that we can be more proactive in the public health, providing of promotions. So that's on the table still, and I think it's being met with positive support. But as we can all see, we're horribly underserved in this department, and our resources are limited. We need to bolster more of the public health promotion, so that it's, at least we're out in the community and we're more transparent and we're more neighbors and residents, and it's not just us flying by the seat of our pants. We need to do more. We need to do more out there. We need to have health fairs. We need to put ourselves out there so that we're not just the bad guys swooping down when something bad happens. I need people to know who we are, and I know I have the board's support on that, so I appreciate it. So that's my nursing division's update, and there's really no new business. So I'll defer to the chair for further action.
Margaret, Stan, do you have anything else before we close the meeting?
No, Madam Chair.
No, I don't. I think we're good.
All right, we will officially close this meeting at 18:50.
Thanks, everybody.
Thank you.
Thank you.
Thank you.
Cheers.